October is Breast Cancer Awareness Month, a time not only for education and early detection, but also for hope and survival. A local pharmacology professor went from teaching healthcare providers how to treat patients to becoming one herself. She reminds everyone that cancer does not discriminate, and sometimes the best thing you can do is listen to your body. In spring of 2019, Emily Weedman Evans was the picture of health, a triathlete with a clean lifestyle and no family history of cancer. Her first mammogram at 40 came back completely normal. By October, everything changed.
I was just getting out of the shower, putting lotion on like you do after you get out of the shower, and I felt the lump. And so I went back in, and there was a nearly 2-centimeter tumor in my breast that had not been there 6 months ago.
She got the call on Halloween. Stage 1B triple positive invasive ductal carcinoma. It's a fast-growing tumor needing immediate treatment. Despite her background as a clinical pharmacist and professor, her oncologist offered key advice.
I need you to forget that you know how to read studies. I need you to forget a lot of what you know for your own mental health, and that was actually great advice.
3 weeks after diagnosis, she had a bilateral mastectomy, followed by 12 weeks of chemo and nearly a year of targeted therapy. Radiation wasn't an option due to a medical device previously implanted in her chest.
The entire treatment regimen was very hard, but I do think because I was going into it as healthy, I feel like pretty much as healthy as a person could be, I was able to handle a lot of the side effects and stuff.
Her last chemo treatment was on March 13th, 2020, the same day the country shut down for COVID-19. For her family, though, the lockdown provided unexpected protection while her immune system was at its weakest. With 2 young daughters, ages 8 and 13, it wasn't easy to talk about cancer.
I remember telling my younger daughter when we were on a walk, and I said, I'm going to have to get some medicine. It's going to possibly make me sick. I'm going to, maybe be bald. And she looked at me, she said, Mommy, do you have cancer?
She lost her hair, eyebrows, and eyelashes, but not her spirit. Today, Emily is 5 years cancer-free. While doctors no longer use the word cured, her risk of recurrence is low.
I've been a practitioner, but to be on the patient side of a very, very serious diagnosis, it gives me a better feel, a better empathy, and a better idea of how to best communicate with a patient, which I can then pass on to my students.
Her advice to others: listen to your body and don't wait.
It's not even about formal self-exams. It's just about knowing what's normal for you. And so the more familiar you are, the better.
And don't forget to wear your pink today for breast cancer awareness. In partnership with Willis Knighton Health, we're wearing pink every Friday this month. We encourage you to wear pink too, and you can share your pics in pink by sending them to pics@ktbs.com.